Afternoon, everybody. You are welcome to. Yeah, good afternoon. You are welcome to today's online facilitation. This is our 4th week of this facilitation, and I want to welcome everyone for making out time to join today's class. Please ensure that you mute yourself. I've muted you, but I can still see that there are background noises. So without wasting further time, like I said, today is week 4 of our online facilitation. And earlier on, I think yesterday, I posted the instructional video of what we will be discussing today. I expected learners to have downloaded the instructional videos and listening to it so that we can have an interactive session this evening. Like I always remind learners that the 1-hour facilitation is not a lecture. It is a facilitation. It is a student-centered form of learning. How do I mean? Students are supposed to come up with questions, are supposed to throw questions to us and bring areas that are not clear while studying your materials. And the whole essence of making available all this medium of assisting students is for students to be able to pass their exams at the end of the day, seeing that the rate of failure is on the high side. We do not desire any student to fail. And so I assure you that if you take part in all the activities, you attend the online facilitation, you download the instructional videos, you do your quizzes and your assignments, there is no way you are going to fail your exam, because definitely all that we'll discuss is what will come out in your exam. So I encourage learners to please, out of your busy schedule, make out time to make sure that you also do your part. You listen to the instructional videos and you attend the online session. And so today in the topic, for those of us that manage, let me even see the hands of those who manage to download the instructional videos and go through it. Okay, if you manage to go through the instructional video, just put it on the chat. Yes, I did. And let me welcome your feedback from what you gained from the instructional video. It's a short or summarized lesson or video on what we will be discussing today. So let me get your feedback. So again, this is NSC 303, Concept and Strategies in Public Health. And so we are on Unit 4, as I said, and the title of Unit 4 is Organization of Health System Based on Primary Health Care. In the previous lesson, we have dealt with the meaning of primary health care, health for all. And today, briefly, we are going to be interacting together on organization of health system based on primary health care. Don't forget that you are in class. I crave your contribution, your interaction. It is a facilitation. It is not a lecture. So I'm not expected to do the talking alone. So what do you understand by organization of health system based on primary health care? Although I have a few slides that I'm going to share, but before I start sharing my slides, let me hear from you. Let me hear from you. You put it on the chat, what you understand from the resources that I've provided and you have gone through it. What do you understand by organization of health system based on primary health care? As we know that we have 3 levels of healthcare system in our nation. We have the tertiary, we have the secondary, and we have the primary. So basically what we will be looking at is the primary organizational level. That's what we will draw more on. And so while I'm waiting for your chats and your feedback, let me quickly share the learning goal for this week. This week, at the end of today's facilitation, learners should be able to define health system. What you understand by health system, the characteristics of health system, describe the organizational structure of health system at the 3 levels that I just mentioned, and be able to explain the role and organization of National Primary Healthcare Development Agency. And so, what do we understand? What do you understand by healthcare system? It's simply a coherent whole of many interrelated component parts, both sectoral and intersectoral, as well as community itself, which produces a combined effect on health of the population. What do we mean by coherent whole? So this is the definition of health. So in case it comes out in your exams, just kindly note that. And we also have the components of health system. What are the components? It has the ideas, the objects, and the person. These are the components that we look at in the health system. The idea, an example, is the coverage, the effectiveness, the efficiency, as well as the impacts. When we say objects, what do we mean? You want to talk about the hospital, you want to talk about the health center, you want to talk about the program. And when we say person, what do we mean? That is the consumer as well as the provider. So all these are the components of health system. So don't forget the 3 components of health system: ideas, objects, and persons. An example of each of these. And so, like I said, that there is aim of health system, and the aim includes a continuous and progressive improvement of health status of the population. The essence of health system is to continually and progressively improve the health status of the population, that is the community. And so you want to look at how we can promote good health, that is the well-being of the population or the nation or the community, how do we prevent diseases in the community, as well as how do we cure those who have already come down with the disease and also rehabilitate them. So these are also 4 key notes that we need to understand when we are looking at the health system. Before we go into the essential characteristics of health system, let me welcome your contribution. Since you have gone through the instructional video before this time, let me stop sharing and get your feedback. Okay, I'm waiting to get your feedback on what we have covered. I said that this is not a lecture. This is a facilitation. And so if it is a facilitation, it's supposed to be an interactive one. I'm not supposed to talk much. We are supposed to relate together. And so while I'm waiting for your response on the chat, let me quickly go through the essential characteristics of health system. What are they? Of course, the system should encompass the entire population on the basis of equality and responsibility. And this includes the health sector and from other sectors whose interrelated actions contribute to health. Of course, there are other factors or sectors or components that their activities or their role are interrelated with health system. And we want to look at the education sector, we want to look at the public works, we want to look at the animal husbandry, as well as the agricultural sector. Of course, you will agree with me that all these in the community are interrelated with the health system. In a situation where there is no food, how do you expect people to have good health? And so all these are interrelated with health system. And so we also look at the socioeconomic of the community. So primary health care actually consists of at least essential elements. And I think earlier, in our first week or second week, I did mention the 4 H's of primary health care. So there was a definition of primary health care during the Alma Ata conference that was held in 1978. Don't forget that definition and the 4 key aids: the acceptability, the availability, the accessibility, and the affordability. Whenever you are defining that definition, make sure that these 4 aids are comprised in them. And so a good intermediate level, more complex problems should be dealt with, and more skilled and specialized care, as well as logistic support, should be provided. Better trained staff, that is, in the system, the supervisory staff, the manpower should be well trained. It is very important to have able and efficient manpower in the system. What are the structural organization of health system. The health system in Nigeria is organized at 3 levels: the federal, the state, and the local level. So we are going to unpack these 3 levels. We start with the federal level. What are the roles of the federal Ministry of Health? Of course, we see that the Federal Ministry of Health is headed by a minister. It is a political appointment. And because it is a political appointment, they also have a department and their roles or their functions. And they are the ones that have in charge of Department of Personnel Management, Department of Finance and Supplies, Department of Planning, Research and Statistics, Department of Hospitals Services, and lastly, the Department of Primary Health Care and Disease Control. So all these functions are under Federal Ministry level, the organization of Federal Ministry level. So we've seen the function of the federal level. Quickly, we'll move to the state level. At the state level,
1 minus 1 is equal to 0. 10 plus 10 is 1.
At the state level, what are the functions at the state level? So we want to quickly look at the state level. What are the functions at the state level? I just enumerated the function of the federal level, the organization at the federal level. So at the state level, what are the functions? So quickly, I'm going to share with you the function or the responsibility at the state level. And so at the state level, at present in our country, there are 36 states and the Federal Capital Territory, Abuja, and has many types of health administration. In all the states, the management sector for health lies at with the Ministry of Health, lies at the Ministry of Health. And so the Health Management Board also, the Health Management Board also participates in the management. Let's look at the function. State Ministry of Health Organization. The State Ministry of Health is headed by an honorable commissioner, while in Health Management Board, there is governing body with an executive secretary. Don't forget, at the federal level, there are directorates and the head departments. But at the state level, they are called honorable commissioner. So the commissioner is also a political appointment, while the permanent secretary also is a political appointment with administrative head. And so there are directors, managing, excuse me. So let's look at the function. On the slide there, we have some of the functions of the State Ministry of Health. I've said that they are political commitments because they are political appointed. Establish a managerial process, public information and education, financial and material resources provision, intersectoral action, as well as logistics system, health manpower, recruitment, and retraining. So it is at the state level that there is health manpower recruitment, that is, they employ. It is also their responsibility to employ manpower and also train them. They also prioritize health programs as well as technology. So the last level, which is also known as grassroots level, local level or grassroots level. We have 774 local government areas in Nigeria with various health facilities operating under the hands of primary health care. It is important to know that the primary health care is a vital level that if it is well managed, the state level and the federal level will also be well maintained. What functions does the local government, which is the grassroots level, do? Provision and maintenance of essential elements of primary health care, environmental sanitation, health education, design and implement strategies to discharge the responsibilities assigned to them under Constitution to meet the health needs of local community under the general guidance, support, and technical supervision of state ministries. Also, motivates the community to elect support of further leaders. And so the local level strategy for health activities is an essential aspect that we cannot overemphasize the role, as we know that a large number of the population reside in the community compared to the city. And so, and we want that people that are staying in the rural community to be able to have access to health care. And so if the grassroots, if health system at the grassroots level, which is the primary health care, are well maintained, then it's going to be much easier for the community, not just for the community member, even for the government. And the workload at the state level and at the federal level will be reduced. But let me quickly ask, for those of us that are live, what do you think is the challenge with our primary health care? Most of us are already working. Some of us are even working in the primary health care. Let's share from your experience. What are the challenges that you experience with primary health care? What are the things? How do you think the grassroots level can be enhanced? Don't forget that the primary health care, the aim is to ensure that healthcare services are affordable to everyone. And that is what we discussed last week, health for all. Everyone should be able to have access to healthcare service. It must be affordable to everyone. It must be accessible to everyone. And that is why we have a lot of primary healthcare, PHC, in the community for people to be able to access healthcare service. And so if we still have the secondary level and the tertiary level being flooded with patients, what is the problem? Is the organization of our health system what it should be? Especially based on the PHC. Please. Okay. I crave your contribution. Please, this is class. Like I said, this is not a lecture. This is supposed to be a facilitation. And so let's interact together. The organization of health system based on PHC, is it what it should be? If not, why? Okay, keep sending your response. I can. Okay, learners, I also want to let you know that if you don't speak up now, you won't know whether you are right or wrong. It is in the class session like this that you can clarify whether your thoughts are right or wrong. With an exam, you won't be given the opportunity. So it's better you speak up. Let's interact together now. And whatever you involve yourself in, it becomes part of you. You can hardly forget. And this is why I encourage every learners to please come prepared for the class. Ask any foolish question. As a matter of fact, with me, no question is foolishly asked. So ask whatever. If you have gone through the instructional video and you do not understand anything, ask question. Let's reason together.
Okay, good afternoon.
Good afternoon.
Well, one of the problems I understand with the primary healthcare is that they don't have trained personnel. That's number one. Number two, they lack equipment.
Okay.
Proper equipment. And the working conditions are not good. Okay. So most of them, they don't want to stay there to work.
Okay, thank you for your contribution.
Thank you.
Actually, from what we have discussed, in the last few minutes, whose role is lacking? Is it the state level or the federal level or the local level? Who are the people in charge of training manpower, recruiting manpower and training them and providing materials or equipping or getting budgets for the
At the local,
okay.
yes. Ma'am.
Okay. Actually, from what we discovered, you will see that it is the states. You remember that the states assist the local governments.
Yes.
The states are responsible for the local governments. So it means that the state level of our healthcare system needs to enhance their functions. I agree with you. I've worked in the primary healthcare settings before,
Okay.
and it's horrible. And that is where we need to, our leaders, we also need to emphasize that they need to budget for the primary health care
Yes.
and equip that level. So I agree with you that many do not like to work in the primary health care because of the working condition. However, that is not how PHC is designed to be. PHC is designed to be a system that will help reduce the burden of the states and the federal. And so hopefully things will get better and the primary health care level will be what it should be. It will be what it should be. And so for those of us who have contributed, thank you so much. I posted an assignment last week. Please endeavor to do the assignment and submit it so that I can assess you, and also prepare to have a quiz next week. Next week, please encourage your colleagues to please attend. We are going to have a quiz next week. And all this, the attendance, the assignments, the quizzes, plus your exam would make up your final exam. And so please, okay, I can see your electronic end. Please speak up. Edith. Edith, I can see your electronic end. Please speak up.
Hello, ma.
I
Hello,
can
ma.
hear you. I can hear you.
Okay, sorry. Last week, ma, I was not able to join the class because of network problems. So how will I possibly get the assignment that you posted? I tried throughout. I was not able to join.
Okay, it's on the student page. It's on the student page.
Okay.
Every week is there. I post the instructional video in each week. You'll find the assignment for last week under week 3 is there.
Okay, ma.
Yeah.
Okay, ma. Thank you, ma.
You're welcome. All right, I think that's where we would end it today. So far, we've looked at the local strategy for health activities. We've examined this illustration, which provides an overview of healthcare delivery system at the 3 levels of healthcare. That is the primary, the secondary, and the tertiary level. As you know, a full range of primary health care are being rendered through the Agency of Primary Health Centers, while secondary health care is being provided through the establishment of cottage general hospitals where all basic specialty services are being made available. At the tertiary level, is being provided at teaching and specialist hospital where super specialty services, including sophisticated diagnostic, specialized therapeutic and rehabilitative services are available. So this is where we are going to end it today. I want to welcome your questions, and if you have a contribution on what we have covered so far and what you have listened to and read from your course materials. Don't forget that this 1 hour online facilitation is not enough. So I encourage every one of you, and also do encourage your colleagues as well, to endeavor to download the instructional video, listening to it, as well as read your course materials and other resources that has been made available for you on your student page. So if there is no question or contribution, this is where we are going to end it today. Don't forget that our 1 hour live session is every Thursday between the hour of 4 to 5. So I'll see you next week, same time, same day. God bless.